Welcome, Dr. Benjan.
Great to be here.
You've described the way we deliver healthcare as being like a disorganized kitchen. Tell me about that.
Well, certainly imagine that you have a restaurant. It's a gourmet restaurant, and you've hired some absolutely fabulous people to work with you. Great chefs. But while people are sitting and enjoying a great meal, behind the scenes you have people that are trying their best but are really running off their feet and feeling exhausted. They may be feeling exhausted because the kitchen isn't designed in a way that helps them do their job in the best possible way. They may be having to be running around to different places to get what they need. They may be having difficulty finding what they need. There may be problems with communication. Maybe the orders are coming in on a piece of paper and they're struggling to read what that piece of paper is saying, and that slips of paper gets lost. And the kitchen is running so at such a high speed that it's very difficult for those people to stop what they're doing and think, how are we going to redesign this kitchen so that we can do the best possible job that we can? And that, I think, in a nutshell, is what often our healthcare system seems to be like. We have a lot of really dedicated people trying their best, but we don't have a system that is organized in a way that delivers the best possible quality of care.
So what can we do to change that?
First of all, we have to stop what we're doing and give time away from people's busy jobs and to stop and think, how can we redesign the care in a way that makes the most sense for everybody involved, particularly the patient, so that the patient's journey is most, everything is centered around the patient and the patient is moving through the system in a timely fashion.
So it's a question of not only focusing on our results, but on making sure that we have a quality system throughout that will deliver those results consistently.
Absolutely, and it requires leadership, it requires commitment, it requires teamwork, it requires the patient's voice into that process.
There's a lot of emphasis on public reporting of information on healthcare. How would that help improve the quality of care?
Well, it's absolutely essential that the public receives good, objective information about the quality of healthcare that it is receiving. That we strongly believe that that's a fundamental right of the public. It's something that promotes. It's very much related to the idea of public accountability, and when you put that information, it gives all of us who work in the system, I guess, the additional sense that we need to address this. We need to serve the public better. But what we emphasize over and over in the work that we do is that reporting is only one part of the piece. And when you identify problems, that's just not enough. You have to have other activities that follow up from that will really drive you changes and improvements in care.
You formed the Chronic Disease Management Collaborative to make that kind of change, to take information and turn it into higher quality. Why did you start there?
Well, again, it's related to our philosophy. Some of our first reports to the public on quality of care were about the quality of heart attack care, where we found gaps in many patients not being on the right medications, on variations in mortality. Another study on diabetes showed that, again, only half of the patients had their diabetes and cholesterol adequately controlled. Those are things that very much were examples of identifying problems in the system, but then trying to create coordinated activities that tackle those problems head on. And that's exactly what the Chronic Disease Management Collaborative aims to do, is to improve quality of care for people with coronary artery disease and diabetes, and also to help them get into their family physician more quickly.
How does the collaborative work?
Well, a key part of the collaborative is that we have many quality improvement teams and family practices that are all voluntarily participated in this initiative. And they are teams out there in the field in each health region actively trying to think about how can they change the way that care is delivered. Going back to the analogy, how can we reorganize the kitchen so that we best serve the people that are important to us. At this point, we have the participation of 28% of all family physicians in the province, as well as all the different health regions. And a number of things are happening. They are coming together at several points during the year where they learn about different ideas that they could be implementing in their practices. It may be, one team says, I tried this education tool with the patients and they really liked it. And so another team will say, hey, that's a great idea. I think I'll try that in my setting. It's that type of interaction that we are fostering. Another key part of the collaborative is information, and each of the participating practices uses a web-based patient registry that we've developed, so that they can better track all their patients with these conditions. They know whether or not their quality is improving over time with all the different ideas they're trying. They know which practices may be doing better than them, and then they can share ideas. And they're also finding out about which patients need to be followed up more vigorously within their practices.
So they learn from each other and they get very concrete information support.
Absolutely.
For interpreting it. Are you seeing improvements?
Yes, and that's very exciting. To emphasize, we're still in the midst of the collaborative, so there's still a lot of work to do. But even at some of the earliest stages of the collaborative, we're finding that that more patients are on the right medications. 9% increase in patients on antiplatelet therapy, 8% increase on patients on ACE inhibitors with diabetes, increases in patients with adequately controlled blood pressure or blood sugar, more patients on cholesterol-lowering agents, and that's just in the early stages. So we're very excited and look forward to even bigger and better improvements in the near future.
Thanks very much.
My pleasure.